Dr. Emily Brunson, anthropology professor at Texas State University, joining us now. Thank you so much for joining us, Dr. Brunson. I have a lot to ask you, starting with our feelings about vaccines. They didn't begin with COVID-19. There has been a lot of misinformation about vaccines through the years. Can you speak to that?
Thinking about childhood vaccination, because that's most of the vaccines that are given, there has been, and increasingly so over pretty much the last 2 decades, and increasing levels of what's referred to as vaccine hesitancy. And this can involve people saying, absolutely, I'm not going to vaccinate, or, I may vaccinate, but I have concerns and I'm hesitant. I want to make sure that I'm doing what's right for my child. It has to do with social media and people being able to talk more, and internet access where you can learn more and do some investigations on your own. And then also, as that became common, it spreads through social networks. So you tend to see clustering of people who are vaccine hesitant. And like what happened in previous pandemics, people have concerns that are related to that. And so one of the things that we've seen with H1N1, when the vaccination came out in 2010 for that disease, there were concerns that members of the public had, even members of the public who had been very pro-vaccination, who had always gotten vaccines. And they were worried. And some of the things that they were worried about were that the vaccine had been produced too quickly, or that it hadn't been adequately tested, that it was somehow unsafe. And so we're seeing some of the same concerns cycle through this time as well.
So we sit in a very interesting position, facing quite the dilemma. On one hand, we are dealing with a historic pandemic in COVID-19, and everyone wants to get to the other side of it, right? But then people are saying the avenue, the pathway is this vaccine, which butts up against a lot of concerns, real situations that have happened through the years. I mean, where do we go from here?
So the first, it comes down to meaningful communication. There are 2 technical aspects of vaccination that the public really does need to understand better than they do now. That we may end up with multiple vaccines from multiple manufacturers. Some of them might require 1 dose, some of them might require 2. Some of them might work better in certain populations, like some of them might be better for older adults, some of them might be better for children. So we need to understand that. We need to understand what's going on in communities and be able to meet people where they are in terms of the messaging. Another thing that we need to do is to earn public trust in fairness of the vaccination campaign. That things like the pre-existing inequalities that we were just talking about, as well as politicalization of the pandemic, all of these have the capacity to undermine whatever trust was existing before. There are a number of people who lack health insurance, who lack access to care. And so this can't be an issue of, some people can get this because they have money and other people can't because they don't. So fairness has to be, giving this to everyone who wants it. We also need to think about developing allocation and distribution strategies that really account for some of these racial, ethnic, and social factors that right now might be dividing communities. How can we build in something so that it's really fair for the different people involved?